It may seem as though there is more to skin cancer than what meets the eye. It's no surprise that complexities and misconceptions surround such a deadly disease. According to the International Agency for Research on Cancer, IARC, an estimated 330,000 new cases of melanoma were diagnosed worldwide in 2022, and nearly 60,000 people lost their lives to this disease. Well, fortunately, this is Untangle, and we're here to clarify the complexities, debunk the myths, and set the record straight about what skin cancer is and what it is not. My name is Blessing Dagin, and I will be your host. Well, joining us today to help break down the topic of skin cancer is Dr. Ahmed Sagir, a dermatologist from the Abuja University Teaching Hospital. Thank you so much for being here, Doctor.
Thank you for having me.
All right, so let's go straight to the issue of the day, skin cancer. You know, it's often misunderstood by a lot of people, so let's start from the basics. What really is skin cancer?
Yeah, so as the name implies, skin cancer, it means cancer affecting the skin. And generally, medically, when we talk about cancers, we're referring to an abnormal growth of a tissue or of a cell within the human body that is so abnormal that it begins to grow autonomously, unlike that is, it is not amenable to the usual control of the human body. Now, the cells in the body have timeline, the number of days they are supposed to last, the kind of activities they are supposed to do. Cancer cells, on the other hand, are on their own, they are autonomous, sort of. So an abnormal growth of the skin that is cancerous generally is referred to as skin cancer.
So for laymen, could you kindly break it down? What does autonomous mean in this regard?
Oh, okay. The word autonomous just means they are on their own, sort of.
Okay.
Without any control, like acting just on their own without any control, or not under the influence of the normal checks and balances of the body. They are just on their own.
On their own.
Yeah.
All right.
So that's what it means.
Okay, they are independent.
Independent.
All right. Okay, so what really causes it? Are there specific things you do to your skin that will, result to a skin cancer, or how does it happen?
Yes and no, because when we talk about skin cancer, we're not referring to just a single thing. You know that the skin is the widest or the largest organ in the human body.
Yeah.
Now, so since it is the largest organ in the human body, one would expect that there's a lot that comes with it. Now, when we talk about skin cancer, there are actually different types of skin cancer.
Okay.
Now, and these cancers arises from different components of the skin. Now, the skin, we see the skin from the external environment, that's what we see, but it contains a lot of things within it. There are cells that make the skin, sort of the lining of the skin. You would agree with me that the skin produces sweat, right? And then in some other parts of the body, it produces oily materials, right? Now, it also brings out hair as well, right?
Yeah.
Now, all these structures have the potential to become cancerous. So the skin layer itself, which we refer to as the keratinocytes, can become cancerous. Now, the part of the skin that produces all those oily substances we see on our face also have the potential to become cancerous. Then there are also blood vessels within the skin which also have the potential to become cancerous. So when we talk about skin cancer, I'm not referring to a single thing. So we have a lot of skin cancers. However, the commonest, the one we hear more often, there's one we call squamous cell carcinoma, then basal cell carcinoma, then the melanoma, which you mentioned.
Yeah.
And then some other types of cancer like Kaposi sarcoma, sort of. There are quite a number anyway. So the cause of skin cancer would now depend on which one we're talking about. You understand?
Okay.
Yes, which one we're talking about? Are we talking about the squamous cell, the basal cell, the melanoma, and all that? So the causative or whatever causes it, for some, yes, there are things we do to ourselves that can aid in the development of the skin cancer. While in others, there's really nothing we can do. They arise for some reasons that are not within our control, sort of.
All right, so let me take you back to my introduction where I talked about the melanoma.
Yeah.
Then we'll also touch on the other two you mentioned, the basic or the common ones.
Yeah, the reality is even the squamous cell carcinoma and the basal cell carcinoma are the commonest form of cancers, then the melanoma skin cancers.
All right.
And because they account for close to 1 million cases annually, basal cell and squamous cell carcinoma, while the melanoma accounts for around 300 to 350,000 cases annually.
All right, so let's unpack everything. Let's not focus on anyone. Let's start from the very first one you mentioned. What causes it?
So generally, there's a common thing to these three cancers that I've mentioned, and which is exposure to sunlight. And that's a very, very common risk factor for the development of skin cancer, especially these three that I have mentioned. Now, luckily for us, I think for the first time, or maybe one of those rarities where the black skin has that advantage, because of the melanin, yes, that our skin produces, it tends to protect black persons from developing skin cancer. It's not like we cannot or we do not develop skin cancer. We do, but compared to the whites, it is far, 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 far less common compared to the whites. So the basal cell carcinoma, the squamous cell carcinoma, and then the melanoma, exposure to sunlight is a major risk factor. Then the other factors are, of course, some acquired infections, like by human papilloma viruses, have been implicated in the development of things like squamous cell carcinoma. Then the other thing is when having an injury on the skin for a very, very, very long time. You understand? You have an injury, you apply one thing, you apply another thing on an injury on the skin. That also an injury that is initially, or because of repeated application of external agents on that skin, it can mutate or change and transform into skin cancer. Then very importantly, especially within this our environment, when we talk about skin bleaching agents, they too have been implicated in the causation of some of skin cancers, such as squamous cell carcinoma and others. And that is because a lot of these skin products contain things within them that are known to change the natural form of the cells that are within the skin, and they turn them into cancers. Then the other contributing factor is the immune status of the individual. Now, individuals who have a reduced immunity from one condition or another, such as, let's say, HIV or medications, because of some chronic ailments that they have, medications that suppress the immune cells, sort of, that too can predispose to some skin cancer. Then family history too as well. If one has had a family history of a skin cancer, the chances of that person developing skin cancer is also high, especially for the melanoma skin cancers. Then there's some form of treatment itself. Say somebody has one problem in the skin or internally, and then the person is now exposed to radiation therapy. There's something we call radiation therapy. Or we call it radiotherapy generally, in the treatment of maybe some underlying cancers, you understand? So the fact that the skin has been exposed to this radiation, that is also another risk factor for developing skin cancer. So these are just some of the factors. There are many, depending on which of the skin cancer you are looking at.
All right, thank you so much. I'm already gaining a lot of insight. So being a cancer that is common, but then people are not aware of, right? What are the very early warning signs that one could see on, their skin and then probably know that, oh, this could be? Well, definitely diagnosis will have to come in before you conclude, but then what are the early signs?
Okay, yeah. As it is always said, prevention is better than cure. So
Yeah.
for many diseases, early detection
Yeah.
is very, very important. And that is one advantage, I would say, that the skin is readily visible. You can easily see it, you can easily touch it. If you even need to conduct a test on the skin, it's so easy to do. You understand? Unlike when you talk about structures that are internal, that something will be happening, you may not even know until it is very, very late.
Yeah.
And also, even if you know something is happening, you need some sophisticated investigations and tests in order to be able to sample that internal organ.
Yeah.
But for the skin, we have that advantage that the skin is just outside us. We can easily see it, so we can easily note changes. Now, there are at-risk individuals, especially amongst us that are blacks. I don't know if you've heard of this population called albinos or albinism. Now, they are at a very, 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 in fact, that is the population. It's not like cancer is not, skin cancer are not so common in blacks. However, in this population of albinos, you understand, because they lack the pigment, that melanin we're talking about. There's absence of melanin. So those population of individuals are at a very high risk of developing skin cancer. So, and they have changes they see on their skin that that are precancerous, that is, if allowed to stay for a long time, would transform into cancer. So such type of individuals, generally, it is advocated that regularly they should go for checkup. Now, for the general population, once you have an injury and the injury is taking, say, too long to heal, you understand, or you just see anything abnormal. Sometimes it may not even be an injury, because some of them do not start as injury, it just starts as a growth. You understand? So it is advisable that once you notice a growth on your skin, just see a specialist to take a look at it. Now, there are other people who are giving birth to with birthmarks. Right?
Okay.
Yes, giving birth with birthmarks. You see a darkish discoloration on the skin and all that. Now, all those birthmarks too, and some of them have that potential to become melanoma. That's another type of skin cancer. Now, there's something we always tell people about birthmarks, especially dark ones. Once you notice you have a birthmark or a darkish discoloration on your skin, and the size has remained relatively the same over a period of time, but all of a sudden you start noticing some changes in the size. Something that was small is now increasing in size. Something that is black is now beginning to assume a different color. It's now beginning, instead of just black, we are now having shades of black, brown, and another color, you understand? That is also a sign that's an early warning sign that this thing is likely undergoing a cancerous change, you understand?
Yeah.
So we've talked about the size, we've talked about the color, then also there's something we refer to as asymmetry, and even asymmetry, it used to be regular, as per the edges, kind of, let's say they used to be smooth and then now they are becoming sort of irregular. I don't know if there's a way I can explain that. But generally, for someone who has had a birthmark and then this birthmark is beginning to undergo changes, that should make one to suspect that this could be what a cancer trying to form, and should seek for medical advice. But more importantly, albino population, those are very, very high risk population and should present themselves regularly for screening of the skin and for skin cancer screening generally.
All right. So it seems as though there's a lot more to uncover when it comes to skin cancer, because already we have heard a lot of new things from our guest in the studio. Well, now we take a very short break. When we come back, the conversation continues. Please stay with us.
Everybody has a stake in making the world a better place with love and compassion. As we thrive daily, we continue to strive to face the many challenges that faces our Earth, because together we all matter. On one side, we are exploring the captivating stories, the trends, the glamour, while on the other hand, we're looking at the love, the care and compassion from our champions. In our Stars Quiet Cove lies the burning passion for humanity, which is seldom known and unsung to the world. Join me on Famed to look at the flip side of your favorite beyond the regular.
For 2 seasons, Timeline has taken you on a journey of exploring real-life issues and solutions. Well, we are on to season 3 of Timeline, a space where we talk about real issues shaping our world. Here, we sit down with voices that matter, with people who are driving change and making impact. We are talking about more than just problems. We're talking about the attainment of our collective commitment, the global goals, the SDGs, and of course, our community-specific targets. Our conversations aren't just about highlighting problems. They're about finding solutions that truly works, solutions that touches lives and impact the globe. An appraisal of how close we are in meeting our global and community targets. We create rooms for honest, thought-provoking conversations, a ride that you wouldn't want to miss. Well, this is Timeline, where conversations lead to solutions that change lives.
Well, thank you for staying with us. I still have Dr. Ahmed in the studio, and we're still talking, of course, about skin cancer. All right, so, doctor, being that you've given us all of the, early signs or symptoms of skin cancer, I would like to know, how do dermatologists, how do they test for this? How do they diagnose it? Are there specific instruments or machines that are used for diagnosis, or how does it happen?
Yeah, so there are, we use a lot of things from our clinical acumen. That is what we see. Based on the history, we interact with the patient,
Okay.
to find out how long he has had that change in his skin, likely maybe an ulcer or a wound, rather, as Nigerians will call it. That
I was
has
going to say
refused-
an ulcer.
yeah. When we say an ulcer, we mean there's a break in the
In the
continuity of the skin, sort of. Yeah, that's an ulcer.
Oh.
Yeah, so if an individual has an ulcer that has refused to heal, you know, or we are now seeing some changes based on our interaction with the patient, then we examine the patient, and then there are things based on our examination that will give us very high index of suspicion that we are dealing with a cancer. And then after that, of course, very importantly, we need to subject it to laboratory tests. So we have a way of taking a part of the skin. Like I said earlier, the skin is just so out, we're seeing it, so you can easily have access to it, take a part of it, take it to the lab. It's going to be viewed under the microscope, and then they're going to see some key features that are typical of cancer cells. So with that, we make diagnosis. Sometimes it's not as simple as that. We may have to, the specimen taking may have to undergo several other tests for one to establish that is a skin cancer. But in most cases, when we take Once we take some part of the skin where the patient or individual has the problem and we view it under the microscope, we're able to tell whether we're dealing with a cancer or not.
Okay, so basically, how accurate can you say a skin cancer diagnosis?
No, very, very accurate.
100?
Very accurate. I wouldn't put 100% to it, but very accurate. Like I say, in most instances, in the diagnosis of cancer generally, the major problem that people face is accessing that part of the body that you think has undergone cancerous formation, sort of. Imagine somebody having cancer of the brain. How do you want to take the tissue of the brain to test? Do you understand?
Yeah.
So imagine somebody having cancer of the lungs. You understand? Yeah. So, but for the skin, it's just there. You're seeing it. So it's easy to sample it and check it under the microscope. So, and there are many tests and with very, very high yields that diagnose it very, very easily.
All right. So, what would you say are the most common treatments when it comes to common and most effective treatments when it comes to skin cancer?
Yeah, so like I said, many types of skin cancer, and then the treatment depends on the type the person has. But generally, what is common to most of these skin cancers is that there's something, just like the adage goes, prevention is better than cure, and then whatever it is that is picked early is usually more amenable to treatment, to even a cure, than when you allow it to linger for a longer time and it begins to get bigger or spreads to other parts of the body. So, but generally, if a patient presents early enough, depending on the skin cancer, we can remove it. Like I said, the skin is outside. If you have a small swelling, and then test is conducted and it's found to be a cancer, you take it out completely and you have cured the cancer.
Yeah, I was going to come there. That means it can be cured.
It depends on how early and then the type of skin cancer we're talking about, you understand. So surgery is one, that is removal of the part that is affected.
Okay.
Then there are also medications, and these medications generally, some can be applied on the skin, directly on the affected part of the body. And for some, it's able to take care of it, you understand? Then there are other treatments that involve destroying that tissue, the whole thing, using either heat or electricity or using cold therapy. A lot of therapies are there available for different types of cancers. But for the very late ones that have advanced or have spread to other parts of the body, sometimes we have to use medications that we call chemotherapy.
Oh, wow.
Yes.
There's chemo for skin cancer too.
Chemotherapy just means drugs for cancer, sort of, you understand. So you can also use chemotherapy, give it through the vein, you understand. So it depends on what you're dealing with, actually. But the treatments are many treatment modalities for skin cancers.
That's really, really insightful. So let's move a bit to the whole process of, treating and curing and all of that. Of course, you mentioned that at some point you may get into surgery.
Yeah.
Of course, you use equipment and all of that, technology. So I want to know where are you at? As in the dermatology world, where are you in terms of technology when it comes to treating or curing skin cancers?
Yeah, we all these modalities of treatment I mentioned, we can offer them, but of course, the treatment of skin cancer or any ailment generally has moved from treatment by an individual to what we refer to now as a multidisciplinary approach.
Okay.
Yeah, what it means is that you have a condition. We look at how many specialties can come together and give this patient the best rather than one specialty just. Well, someone will definitely lead, but you may need to co-opt other people into the management so that in the end the patient gets the best. But like I said, if it is the surgery, if it is the top and the medicine that you apply over or the drugs you give, they are all available. But what is key is early presentation. You understand? Early presentation to the hospital. You understand? Once an individual is able to present early, then of course to operate or to remove a cancer is straightforward. You understand? It's not a, what do I even call it? It's not a rocket science technology kind of a thing. Yeah.
Okay. So basically, I know that as a dermatologist, you might have encountered a lot of people who have some form of misconceptions or some myths when it comes to skin cancers. Can you share a few, maybe some misconceptions or myths generally you've encountered about skin cancers?
Yes, quite a few. Yeah. Anyway, most people, just like you said earlier, do not even know that
skin cancers exist.
Skin cancer exists. So that's something. Then people believe that the food they eat, you understand, may predispose them to skin cancer. To date, we've not found any association with food intake. But of course, like I mentioned before, the things you apply on your skin, bleaching creams, some have the potential, especially in this era where we have different people springing up claiming they have body cream and all that takes away a lot of things. You know, they
call it organic.
They promise a lot of things, so you never know what is the constituent of those things. And so some the things you apply on your skin, yes, that is true. I think by and large those are some of the things, the myth, just that I know about that I've heard about skin cancer.
Just the major, you know, when you talked about creams, you know, sometimes I sit back and I wonder why, if you know that melanin is something that really protects your skin, it gives you an edge, why would, you know, people want to break off their melanin and all of that? But then it now leads me to another question, talking about treatment or prevention. What role does sunscreens play, you know, when it comes to protecting your skin from skin cancers? Or is it just for, you know, pimples or, you know?
Yeah, so generally as far as skin cancer is concerned, when we talk about sunscreen, it goes way beyond the application of creams on the face, you understand? But of course, they do protect, especially in at-risk population. Take, for example, an albino. You understand? In those populations, sunscreen is very, very, very important in the prevention of skin cancer. In fact, that forms the bane of the prevention. I mean, the cornerstone of prevention of skin cancer in that population. So it involves wearing a wide brim hat, you understand, avoiding jobs or occupation that exposes them to ultraviolet radiation or the sun rays generally. And then, of course, applying this sunscreen, using goggles and all that. Of course, sunscreen is very, very important in the prevention of skin cancer, especially in at-risk population. Now, for us Africans or Blacks who do not have albinism, sunscreen has its own advantage too, but not necessarily in the prevention of skin cancer. Yes, then also for the whites generally, of course, that would help in the prevention of skin cancer. It does help, especially for the population that their occupation exposes them to excessive sunlight.
Yeah. You know, I'm just wondering how, should I say science now, or how God did it. They are now more at risk of skin cancer. That's the whites. But then their region is sort of cold, mild, and all of that. Because the kind of sun we have in this part of the world, if we were at risk of skin cancer, I just wonder what the story.
So that could just be, in science, they talk about evolution and all that.
Yeah.
So perhaps one of those nature's way of ensuring that you are in the right place, you understand, over the years, if you are in a sunny place, over the year, your skin changes to that type that prevents you from having all those harmful things that can result from excessive exposure to sun.
All right, thank you so much, Doctor. I think it's been an amazing episode on untangling skin cancer. I personally have learned a lot, and I'm sure people out there, viewers, have actually learned a lot as well. But then just before we round up on today's episode, what would you advise people who probably, like you said, one of the early signs could be if you're noticing a birthmark that is changing in size and all of that. If I notice such things on my body, what would you advise me to do? What would you advise be the first step of action I take?
Yeah, the first action that anyone should take is to see a doctor. See a doctor. It's not time to go googling, you understand, or asking people who do not know, Yeah, people who are not well informed. It will be like the blind leading the blind, sort of. We see that a lot in the hospital, sadly. We see people who consult or take information from people who are not supposed to be providing that information. And sometimes they even take those information far superior to the ones we give them, you understand? And then in the end, it's they present late. So generally, whoever notices something abnormal about his skin, should, as quickly as possible, see a doctor, and that doctor would likely refer him to the dermatologist. Quite a number of times, people have developed the habit of just going into the chemist and obtaining a triple action cream, sort of, and then just apply it as a single solution to all their skin problem. And that needs to change. As I said, the skin is the largest organ of the body. You hardly will find one person who does not have one skin problem or the other. That is the truth. Even within, if you see 3-4 people, I'm sure 2 or even the 3 or even the 4 will have one skin problem or the other. But the problem is, for most of us, we feel if it is not paining, if it is not causing discomfort, if it is not itching, or if it is not on the face, that others would see, why do I need to worry about
clothes to cover it up?
Understand the color. So and that's a mistake we make many times. So it's always better, once you notice a change in your skin, see an expert.
Thank you so much, Doctor. It's been quite insightful. Thank you so much for coming.
You're welcome. Thank you for having me.
All right, and there you have it. If you have any issue with your skin, you notice any change whatsoever with your skin, you know what to do. Go straight to the doctor. He would most likely refer you to a dermatologist. This is where we put an end to today's episode of Untangle. See you on our next episode. I am Blessing Dagin.